Our topic for today is care and maintenance of PICC lines. Before you do anything, you have to explain to your patients what you're going to do. This is so you can allay the fears and anxiety of your patient. Gather your supplies, which includes dressing kit. This contains most of the supplies that you will need. Anchor device called StatLock. Injection caps, antimicrobial dressing or bio patch, saline flushes, alcohol pad, and unsterile gloves. You may need other supplies in accordance with your hospital policy. In order to do an effective dressing change, you have to place the patient in a correct position. Wash your hands before you start your procedure using soap and water. Put on a mask. Put on your unsterile gloves. Position the arm in a 90-degree angle so you can see the site you will work on. Open the dressing kit. Remove the sterile drape and place it under the arm. Open the rest of your supplies and put it on the sterile drape. Correctly remove the tegaderm by starting to peel off the edges, starting at the bottom. And pulling the tegaderm upwards. Now change your unsterile gloves to a sterile glove. Now continue to remove the rest of the tape and the gauze on top of the dressing. Now we are going to change the StatLock. Grab an alcohol pad and wipe the edges to aid in the removal of the StatLock. Change it to a new StatLock and stick it in place where it used to be. You can use a skin protectant prep pad to make the StatLock stick better on the skin. Check the insertion site and the surrounding area for any abnormal symptoms such as redness, pain, or swelling, as well as any debris such as blood. Clean the site with the ChloraPrep, starting from the center and removing as much dirt or debris around the site. Let it dry for a couple of minutes. Now we're going to apply antimicrobial dressing, or sometimes called biopatch. And the correct way is blue side up, white side facing the skin. Now we're going to stabilize the extension by applying a tape halfway Now I'm going to apply the tegaderm, and the correct way is by applying one side and stretching it to the other side, making sure that the tegaderm sticks well. Now we're going to change the injection cap. Grab an alcohol pad. Remove the old cap. Clean the hub of the PICC line and remove as much debris as you can. Let it dry for a couple of seconds. Once you're done, get your new cap, injection cap, and apply it. Do the same procedure on the other port. Now we're going to flush the catheter, and the correct way is grab an alcohol pad, clean the tip of the cap, vigorously rubbing it and removing as much debris as you can for a few seconds. Let it dry, and in the meantime, remove the air from your syringe. Connect. Open the clamp. Do a positive pressure flushing. Push, then stop. Push, then stop. Push, and remove your syringe, then close the clamp. Do the same procedure on the other port of the PICC line. After doing the procedure, document your observations in accordance with hospital policy.